You did the right thing getting tested for COVID-19. Testing is the best way to find and slow the spread of the virus. So, what happens next? Well, it may take a few days to get the results of your test. If you test positive, you may be contacted by your local public health department. As COVID-19 cases continue to rise in our community, local public health teams may not be able to call everyone who tests positive. This guide will help you take action to keep yourself, your family, your co-workers, and your friends safe. While you're waiting for the results of your COVID-19 test, you should stay home and away from others. Doing so will keep you from giving the virus to others if you have it. If you test negative, follow any instructions from your healthcare provider. Even if you have tested negative, you may still need to quarantine and stay home away from others if you've been around someone else who has tested positive. If you test positive, whether or not you have symptoms, stay home and separate from others. If you have questions, you can call the Marion County warmline at 503-576-4602. Isolation keeps someone who is infected with COVID-19 away from others, even in their own home. You need to isolate if you have symptoms or have tested positive for COVID-19. If you have tested positive for COVID-19, ask the following questions. Do I have symptoms? Symptoms can include fever, chills, cough, headache, loss of taste or smell, shortness of breath, fatigue, muscle or body aches, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. If the answer is no, you should still isolate for 10 days after testing positive. Stay home and stay away from others. Even if you don't have symptoms, you could still spread the virus to others. If you do have symptoms, isolate for 10 days from the time symptoms began. After 10 days, if 24 hours have passed without fever and without the use of fever-reducing medicine and other symptoms have improved, you have completed isolation. Whether you do or do not show symptoms, once you have completed isolation, you can leave your house and return to work. Continue to use preventative measures including masks and physical distancing. Quarantine keeps someone who has been exposed to COVID-19 away from others. It helps keep people from spreading the virus before they know they are sick or in case they have COVID-19 but have no symptoms. It is very important that you quarantine if you have had recent close contact with someone who is sick with COVID-19 or who has tested positive for the virus. Close contact means spending 15 or more minutes within 6 feet of someone who has COVID-19 within a 24-hour period. Staying home until you can no longer spread the COVID-19 virus is really important, but staying home is not easy and we know you might need help. We can help you get support so you can stay home as long as you need to. Help is available in your community, including food, grocery or medication delivery, financial help for rent, utilities, and other monthly bills, help isolating away from your family, and unemployment and sick leave. After testing, you should receive your results from your healthcare provider. If positive, our team will call to do an interview and identify any close contacts. If you don't hear from public health but need to quarantine, resources are still available. Call 211 and ask about services that are available to you while you are in isolation or quarantine. Call the Marion County warmline to be connected with support for your isolation and quarantine. For a full list of supports and services available through local community-based organizations, information about local testing events, and more COVID-19 resources, visit Marion County's COVID-19 website.